Teachers, I'm Brenna, as I'm sure you already know. We've been hanging out together all night. And today my teaching project is to talk to you about pancreatitis. So, can you tell me what you know about that? More than me.
It's when the pancreas doesn't function well.
Okay. Whenever you hear the word itis, it means inflammation. So it means whatever part of the body is aggravated. In this case, it's the pancreas that's angry. Okay. So I got you that little pamphlet there to read on your own time, but I'll go through it now and maybe have you teach back a little bit to me. Okay. So pancreatitis is inflammation of the pancreas. It can be acute or it can be chronic. And acute, means like one episode or intermittent episodes. Whereas chronic means that it's going to be going on. It's going to be going on for a while. Okay. And acute pancreatitis is when the pancreas starts to digest itself with the pancreatic enzymes. It is usually reversible, but it can happen again and again and again. Okay. And chronic pancreatitis is when the pancreatic tissue is slowly destroyed over a long period of time. Okay. So you might be thinking, what actually causes this? Okay. So acute pancreatitis is usually caused by gallstones, just causing trouble in that area, sometimes, clogging some of the pancreatic ducts. Otherwise, the second most common cause is too much alcohol consumption on a regular basis. However, there are some other things that can be factors, but those are the two big ones. Okay. Some of the other weird ones that can contribute to the development of pancreatitis include some medications, tumors, the third trimester of pregnancy, because why wouldn't something else go wrong during pregnancy, and high cholesterol. All right, and then chronic pancreatitis is usually caused by alcoholism and malnutrition, which those two kind of go hand in hand. So if you're an alcoholic, you're probably not eating enough, let alone good stuff for you. And in chronic pancreatitis, this causes a whole bunch of the proteins in the pancreas to build up and solidify, and which blocks the secretion of the pancreatic enzymes, which means it's harder for you to digest stuff because, well, you need those pancreatic enzymes to digest and break down your food. All right. And then acute pancreatitis might look like some, not all of these, severe upper abdominal pain that radiates into your back. And usually, if it's an acute episode, it'll happen after a meal with a lot of fat, or if there's too much alcohol involved, or both. You might get a little jaundice, which is when you get a little yellow in the skin, nausea and vomiting, and then you might get some bruising around your belly button or your flanks, just out of nowhere. Whereas chronic pancreatitis looks like the same upper abdominal pain that goes into the back, loss of appetite, fancy word for that is anorexia, constipation, nausea and vomiting, and then when you poop, it's going to be really nasty smelling, kind of frothy, it's a smell like none other. It's worse than C. diff. Okay. And then to definitively diagnose it, they do blood draws, like CBC, amylase levels, ultrasounds, a UA, a urine test, a CT scan, and they might just biopsy the organ itself. Okay. I know this is a lot to throw out in this teaching session. And how it is treated. Okay. So, if if it's a chronic thing, it is going to be treated with dietary changes, some medications. Typically, patients with pancreatitis, whether it's acute or chronic, are encouraged to have a lower fat diet because the pancreatic enzymes help break down the fat. Low sodium diet, no alcohol. Sorry. And then if it's an acute episode, pain meds will be needed. And they'll probably be more like the opioid ones because liver, kidneys, not necessarily the happiest with ibuprofen and Tylenol. So, and if it's left untreated, it can kill off your pancreas. Can go into ARDS, which is acute respiratory distress syndrome. Big scary word for your lungs aren't happy now too. Abdominal distension, which is called ascites, which is a fancy term for excess fluid buildup in the abdomen. Organ failure, and death. So, can you teach back any of that to me? I know that was a lot to lay on you.
Yeah, thank you for teaching me that, and yeah, I can get it's the inflammation of the pancreas, and it's like the acute one can be treated or reversed, but when it goes to chronic, then it's kind of hard to treat it, and overall, I think it is best to avoid like the factors that lead to AIDS, like you know,
Correct.
control our cholesterol and avoid alcoholic beverages and try to eat a balanced diet because, like you said, most of the chronic pancreatitis is caused by drinking alcohol and malnutrition. And of course, like you said, it goes hand in hand because when people are drinking, then they are not getting like a balanced diet. So,
Correct.
trying to get a balanced diet, cutting on alcoholic drinks. What else?
Hey, I think you got it.
Oh, okay.
I think she knows more about it than I do. She's an RN.
Thank you very much.
Thank you for being my willing victim at 4 o'clock in the morning.
Thank you for teaching me.
And thanks, Ayo, for
Oh,
coming.
no problem.